Hello, listener, and welcome to the Southern 7 podcast. I do hope this is not your first time joining us, but if it is, I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our central office in Ullin, Illinois. Southern 7 serves the lower 7 counties of Illinois with public health clinic sites and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend. And if you haven't done so, make sure to check out our other podcasts on the Southern 7 app, on Spotify, through our website at southern7.org, and on the Southern 7 YouTube channel. Listener, if you are a parent or guardian of a child under age 18, then you know it's time to start thinking about back-to-school vaccinations. And for some of you, you may have some additional questions as far as what paperwork do you need, what vaccinations my child needs, and, I just have general questions, right? I mean, you're thinking that, I'm sure. Well, since we at Southern 7 know how hard it can be at times to get those done, we're teaming up once again with Dairy Queen in Anna and Vienna and welcoming for the first time McDonald's in Metropolis for our annual Ice Cream for Vaccines program. In today's episode of the Southern 7 podcast, you'll meet two of our nurses here at Southern 7 who'll share information about this fun program and all you should know before scheduling your child's vaccination appointment. So stay right where you are. We'll be back with today's episode in 60 seconds.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
School vaccinations are underway, and once again, Southern 7 Health Department is teaming up with local businesses for its annual Ice Cream for Vaccines program. Kids who get their shots through Southern 7 Health Department will receive a coupon while supplies last for a free ice cream cone from Dairy Queen in Anna or Vienna or McDonald's in Metropolis. Certain vaccinations are required for children enrolled in child care, Head Start, pre-K, elementary, and high school programs. Vaccines are one of your child's best defenses against many serious and potentially life-threatening illnesses and have proven to be safe and effective in protecting kids from serious childhood diseases. For more information, download the Southern 7 app or call
634-2297.
Welcome back to the Southern 7 podcast. Listener, we are so glad that you are with us today. We are going to be talking about back-to-school shots, vaccines, and a wonderful little program that we have going on during that time. But before we get started with that, I want to introduce our guests on the podcast today. First, we have Kimberly Laird, and you go by Kim, right?
Yes.
Yeah, Kim, and we also have Mary Livesay.
Yeah.
Hello, ladies. First off, tell our listeners a little bit about yourself. Kim, we'll start with you.
All right. I'm Kimberly Laird, go by Kim. I am the Communicable Disease Program Manager here at Southern 7. I was born and raised here in Southern Illinois, moved away for a little bit, am back now, and loving what I do.
Okay, well, great. Kim, thank you so much. This is your first time on the podcast.
Yes, it is.
We're going to be real chill on things, and we want you just to have a good time. So awesome. Thank you so much for helping us out. And Mary.
Hi, my name is Mary Livesay. I'm a registered nurse here at Southern 7. I've been with Southern 7 almost 8 years. I work in all the clinics, all 7 of the clinics. I float around, and I also work on the WOW van as well.
Yeah. So folks out in the community see you a lot.
Yes.
They do. All right. Well, ladies, thanks again. I appreciate you joining us today. Again, we're going to be talking about the back-to-school shots. It is coming up on that time of year. And some people may be thinking, okay, why are you talking about this now? It's barely June. But we want people to start thinking about getting their shots early to avoid those last-minute headaches that go along with that. And so one of the things that we're doing is we are introducing, once again, our Ice Cream for Vaccines program. And this is, it's a vaccination program that we started doing actually back during COVID. to help people, get back kind of in the swing. Mary, I know you've been with us since we've been doing this, but this year we're going to be in partnership with Dairy Queen sites in Anna and Vienna, and Metropolis McDonald's is going to be joining us this year. So we are excited about that. So just real quickly, this is going to be taking place between June and December. So if you've got a child that needs their shots, they're under the age of 18. Anytime they come into one of our sites, they will get a coupon for a child-sized vanilla cone at one of our participating locations. So we do want to thank McDonald's and Dairy Queen stores for participating in that with us. Okay, so ladies, let's talk a little bit about vaccinations and why it is so important that parents need to be thinking about this now, as well as what happens in the state of Illinois.
So yes, Illinois state law requires like certain vaccinations for children enrolled in child care, Head Starts, pre-Ks, elementaries, and high school programs. Vaccines are one of our greatest defenses against many serious and potential life-threatening illnesses, and have proven to be safe and effective in providing them from serious childhood diseases. So vaccination rates kind of fell during COVID from 95% to 93% overall. The lowest level, this is the lowest level in the last decade. Many children who experienced delayed vaccination during the pandemic are still behind schedule. This is especially concerning given that this year's kindergartners were born at the beginning of the pandemic. Southern 7 Health Department encourages parents to plan early to avoid any delays in the vaccination process. Typically, it's not suggested to wait until August to schedule your child's appointment because many parents wait until the last minute and then they kind of all schedule at once and it's hard to get an appointment. Scheduling vaccination appointments early gives parents the time to talk with their provider, collect any necessary paperwork, confirm any needed vaccines, and ensure there are no delays at the vaccine appointment.
So, and thank you, Mary. So for us here in our region, we're encouraging our folks to come in. We've got 7 locations, one in each of the lower 7 counties in Illinois, and as well as other health departments throughout the state. So we're just encouraging people to make sure that they're coming in, getting those shots, getting them early, and getting them taken care of. Let's talk a little bit about some of the things that they need to do. Mary, you had mentioned getting the necessary paperwork and making sure those vaccines are in place. What do you tell somebody when they call and ask about that paperwork and what they need?
Usually when they call, we ask them if they have any shot records, if we don't already have them on file, because we need to know what kind of vaccines that they need. They need to make sure that they have their insurance coverage and stuff that they can bring into us so we can make a copy of it, those type of things. And then we kind of tell them what their child needs and get them scheduled.
Where can they get their paperwork? Does that come from their school?
They can get their paperwork from us directly.
Oh, okay.
Yeah.
Okay, I didn't know that. I thought I thought they went. I remember doing it for my kids and having to go through the school system, so I didn't.
Yeah.
Didn't know.
They can come and get our paperwork from us directly. If they don't have their shot record, they can get it from their previous provider or other health departments. Like if they were out of state, they can get them from out of state health departments or their previous provider. And sometimes, yes, the school will have that on file as well. If they're coming from a different school, they can get it from their previous schools.
Okay, so that brings up the question, do they have to live in the Southern 7 counties to get their shots through Southern 7 Health Department?
That just depends on their insurance.
Okay.
As far as like if they have state insurance, like say they live in Kentucky and they have the Kentucky state insurance, they will have to get them in the state of Kentucky. But as long as they have private insurance or Illinois state insurance, they can get it through us.
So if they have Medicaid, which would be the state insurance, then they would have to get that in the state where their child
where they have that state
insurance. Okay. Is the health department able to look up those shot records if for some reason the school doesn't have them or the parent doesn't have them?
Yes, as long as they had them in the state of Illinois. Now it is starting to be where we can transfer from different states in our system, but we would just need the child's name and their previous address of that state and everything, and then we put all that in, and sometimes we can transfer that information over.
Okay, very good. So it doesn't sound like a difficult process at all. You're able to access their shot record, help them with the paperwork, getting their appointments and so on. Now, are you taking appointments or you take walk-ins too?
We are taking appointments. Usually by appointments we prefer, but we could possibly take walk-ins. So if someone does walk in, we could see if we have that immunization available and if we have all the information we need as far as what they need.
Okay.
We could possibly take a walk-in as well.
Okay. And you mentioned being on the WOW van. Are we doing these vaccinations on the WOW van as well?
Not as of yet, but we are trying to get that in the works.
Okay. Oh, very good. All right. Wonderful. Okay. Lots of good information there for first-time parents. And again, we were talking about how it's amazing that we're starting to see kindergartners from COVID. And our biggest concern here at the health department is making sure that those kids are up to date on all those vaccines, because like you just said, we're seeing a little bit of a lag in getting some of that done for a lot of different reasons. And so we just want to make sure people have the information, that the parents have what they need. Kim, if we can, let's talk a little bit about the vaccinations that the kids are required for school. Now, there's a long list of them. I'm not expecting you to know all of those, and they do seem to change from year to year. But in Illinois, what are the ones that we see most often that parents need to make sure they're really focused on?
Well, in Illinois, recommended vaccinations for all ages can include MMR, which is measles, mumps, and rubella, chickenpox, the DTaP, which is diphtheria, tetanus, and pertussis, or also known as whooping cough, the Hib, and then the HPV, which is the one, and then hepatitis A and B and polio. And the Southern 7 health departments, we provide the recommended vaccinations for all of these, all those that I included. Also, the flu, COVID-19, again, the HPV are also recommended, along with meningitis, but they're not required. Okay.
So we are seeing measles cases. This is something that's kind of like first and foremost on people's minds right now. I know that I heard recently that those numbers continue to drop. Are we starting to see an increase in people wanting to come in and getting those vaccines? Maybe outside of the school? I'm just kind of curious. Outside the school shots, are we starting to see an increase in that?
We've gotten a lot of different calls asking about those. Maybe a little bit of an increase. We have done a walk-in clinic. We did a walk-in clinic in Cairo. And it wasn't so much for the MMR, the people that came, it was for some other immunizations. But we are going to be offering some walk-in clinics also. You had asked about the walk-in.
Yeah.
So once we set some of those up, I think we're talking about MASAC. When it gets a little closer to registration, we'll be setting those up.
With the MMR, I mean, I'm somebody that had it as a child. I'm not going to share my age, but I did have it as a kid. And fortunately, starting to work at the health department, I did get all that updated. But what if somebody doesn't know if they are up to date on the MMR or even other vaccines? Is there a place that they can test? I mean, what is involved there?
They can reach out to us to also look up their records if they don't have their records. And again, like Mary had explained how we would do with the children, we could still do that with the adults, depending on if they had the vaccinations done here in Illinois. I'm not sure if we can pull from the different states, possibly, like what she had.
Yeah, we've been trying to pull. Some we were able to pull from Missouri and Kentucky, so it just all depends. It's the same process with the adults. They can also ask their doctor to either run titers as well, which is just a blood test, and they can run the titers to see if their immunity is low to the MMR. And if their immunity is low, they can have a booster shot there.
Yeah, what is us. Oh, I'm sorry. Go ahead.
They can have a booster shot with us.
Okay.
Yeah.
Let's talk about the MMR for just a second, because right now, again, this is what's mainly on people's minds, even for adults, not just kids. what is the series of shots that they have to have on that, and how far apart do they have to have those to be considered fully protected?
Right. So the MMR vaccine is usually given at 1 year, for 1-year-olds, and before entering kindergarten. Usually, typically at 4, they can start having the MMR. So 1 and 4 is the typical age range. If a person has never had an MMR and they're an adult, you have to at least get them a month apart.
Okay.
So it's a 2-series shot.
Okay.
I apologize, I didn't explain that part.
No, that's fine. No,
It's a 2-series shot, but they usually get it a month apart. Now, if you've had MMR and you have titers drawn and your titers are low, typically that's just a 1 booster shot type thing that you get.
Which is what I did. Now, I didn't have the titers done.
Mm-hmm.
But it had been XXXXX number of years since I did that.
Yeah.
And so they said, let's just go ahead and be safe and make sure.
Yeah, which is just a one shot. If it's considered a booster, it's just 1.
Right. Okay.
Yeah.
And as always, folks, when it comes to vaccines, if you have any questions at all, you can talk with any one of our public health clinic staff. Again, Mary, Kim, they're wonderful to talk to. We also encourage you to talk with your primary care physician to make sure that vaccination is right for you. Because for whatever reason that it might not be, but so we do recommend vaccines at the health department. But again, talk with your doctor about what works best for you. That kind of sums up the majority of what we're doing here. We've covered it in a quick amount of time. But is there anything else that we want people to know about the back to school shots or about vaccines in general?
Back to school shots are typically recommended for preschool, like Head Start programs might require some of those shots, as well as lead and TB skin tests. Kindergarten, 6th grade, and usually a senior shot.
Okay. And what about flu shots and COVID? We said that wasn't required on these. When can folks be thinking about those as far as for their children's concern, if that's something they want to do?
Those are typically seasonal. COVID changes, so I'm not sure the current guidelines, that changes, it seems like. But as far as flu shot, that's typically seasonal. They're not required for admission to school, but they are recommended.
Okay. All right. So we just want parents to be thinking about what is best for them and their family. And the other thing too, folks, we're also thinking about other people who are around your child and in their environment. So if you have somebody that's not fully vaccinated and you have another individual that might be immunocompromised for whatever reason or wasn't vaccinated, again, we have to be thinking about those people too and making sure that they stay healthy and safe through the process, because sometimes people have underlying health conditions that they're not aware of. So when it comes to vaccines, there's a lot of stuff that we think about and people are concerned about, and we rightly understand that. We just want to make sure that you know that you can ask questions, trust the sources that you're talking to, make sure that you're comfortable with them and getting that information. Okay, is there anything else?
I just wanted to remind everybody, again, we were talking about the ice cream for vaccines program and that it's going to run from June to December. Any of the children that come in and receive vaccine that they get that coupon, and maybe that will, a little treat after.
Yeah. Well, because kids don't like getting shots. I mean, that's a 4-letter word to a kid. So hopefully that just getting a free ice cream cone might make the day a little bit easier, especially if grandma and grandpa's bringing you in for your shots. So that might help a little bit. But thank you, Kim, for bringing that up again. We do appreciate, once again, Dairy Queen in Anna and Vienna and McDonald's in Metropolis for supporting us this year. They are always so good to work with. And McDonald's is new for us this year. They said, yes, we want to be a part of it.
Very exciting.
We are very excited about that for sure. And for anybody that wants more information about shots, where can they call? Where can they go?
So any information about routine vaccinations or to schedule an appointment at the public health clinic near you, you can call 618-634-2297. Visit southern7.org, and that's southern7 the number .org, or download the Southern 7 app.
Very good. Thanks, Mary. Appreciate that. And the Southern 7 app, folks, will take you to our website as well. So you'll be able to see all the clinic sites on there, as well as how to contact them and what to do to get that done. So again, want to remind everybody of that. And folks, if you want to share this information with others, we do encourage you to share the podcast today, of course, but we do have all this information on the Southern 7 Facebook, Instagram, and X pages. Go ahead and visit those sites. We do have a video PSA on those sites that you can share that explains this a little bit more in terms of the Ice Cream for Vaccines program and what your kids can do and what you need to do to get them set up for an appointment. All right, ladies, I think that's going to wrap up this episode one more time. Anything else? No.
Thank you.
Thank you. I appreciate the help in getting the word out there. And I always like to refer to our experts. You guys are our experts, and I appreciate that a whole lot. All right, listener, that's going to wrap up this episode of the Southern 7 podcast. Thanks again for spending your time with us. If you like today's episode, please share it with a friend and make sure to download the Southern 7 app and check out our other podcast. This podcast will also be available for audio listening on our YouTube channel. From all of us here at Southern 7 Health Department and Head Start, make it a great day.